and greetings, teacher Lida and friends. Today I am about to talk the second global patient safety challenge, Safe Surgery, Safe Life. My group is composed for my companion
Juan Laike Haga, hello.
and my person is Karen Daniela Bautista. So the introduction in the text is the in October to 2040, the World Health Organization (WHO) launched the World Alliance for Patient Safety in the response to the World Health Assembly Resolution 155 5580, urging WHO and member states to pay the closest possibility attention to the problem of patent theft. Safe surgery is fundamental in the medical field. This presentation will address its importance in safeguarding life, the principle that governs it, and how its implementation can reduce complications and improve patient outcomes. The essential objective is the for safe surgery have as their main purpose to improve patient safety during surgical procedures and the reduce complications and deaths associated with the surgery. In the objectives, first objective is operate on the right patient and the right correct body part. Is the crucial to avoid the serious error in the every team professional. The second, the second objective is the anesthesia-related complication are one of the main causes of mortality and the burden in the surgical context. The main is the implement standard desired and the safe practice in the administration of the anesthesia. The three objective is the team must have a clean plan for highly critical situation. This involves having the necessary equipment and hand such as intubation device, oxygen, and emergency medication. The four objectives, the first objective is recognize and effectively prepare for the risks of the high blood loss. So, uh, have blood products available, such as red, blue, blood cells, violet, and plasma. Transfusion continually monitor the amount of blood loss during the produce. Continually monitor the amount of blood loss during the produce. Every month be aware of the pattern status and the change in the situation. Surgical technique that minimize blood loss. The five objective is about inducing an allergic or adverse drug reaction that is a significant risk to the patients. It is a critical to review the patient's medical history to identify allergies or previous reaction to the medicaments. It is critical to review the patient's medical history to identify allergies in every patient in every occasion. In the sixth objective is consistently use now method to minimize risks of infection at surgical sites. This objective is the prevent to duration surgical items. It is essential to follow the strict protocol for continued instruments and a sponger before, during, and after surgery. The use of technologies such as RFID tape sponges can help improve accuracy. The eighth objective is uh, the eighth objective, is the secure and accurately identify a surgical specimen. From the moment a specimen is extracted, it must be cleaned and accurately labeled. This includes information such as patient name, date, type of the produced specimen, identification of the body. The nine objective is effectively communicate and sharing critical parents information for the safe conduct of the operation. Clear and concise communication is essential. The team members should feel comfortable asking questions and expressing concern in this moment. The surgical safety is the checklist. The checklist is the objective principle in this object.
All right, and for the 10th essential goal for safe surgery or objective for safe surgery, it focuses on establishing routine surveillance of surgical capacity, volume, and outcomes. Outcomes in hospitals and public health systems. This goal is critical, very critical to improving the quality of surgical care and ensuring that appropriate measures are taken to address any issues that may arise in the surgical process. So what are the key aspects for this objective? There are six. So the first one is monitoring surgical capacity. It is important to assess and monitor the ability of hospitals and surgical centers to perform procedures. This includes the ability of the availability of resources such as trained personnel and surgical equipment and the technology needed to perform these surgeries. The second one is recording surgical volume. Keeping on track the number of procedures performed is essential. It's essential to understand the workload and experience of the surgical team. A higher volume of procedures may be associated with better outcomes as long as the quality of care is maintained. The third key aspect is evaluation of outcomes. The collection and analysis of data on the outcomes of surgery, including complication and morbidity, mortality rates, is crucial because allows the identification of trends, areas for improvement, and the effectiveness of the interventions implemented. The four key aspect is establishing performance indicators. This is defining clear performance indicators that can be measured and evaluate regularly. Health hospitals monitor their progress in improving the surgical safety. The fifth one is feedback and continuous improvement. Information gathered through surveillance should be used to provide feedback and to surgical and administrative staff. This fosters a culture of continuous improvement. And the last one is commitment of health authorities. Commitment of the authorities and the administrator of institution of health and maintain the surveillance systems includes allocating resources and creating policies that supports data and collection of analysis. So next slide. So what we achieve or what the WHO present to achieve. The first thing is preventing surgical site infection. We better adherence to infection prevention practice improve, including the implementation of standardized procedures, helps to reduce this type of adverse events, the site infection. The second one is safe anesthesia. It ensures that all pre-anesthetic consideration and intraoperative monitoring techniques are carried out systematically. Here we got the measurement of surgical service. the establishment of systems for monitoring surgical outcomes and the collection of consistent data on surgical performance are encouraged. This makes it easier to identify areas for improvement and allows for more detailed analysis. And the last one is safe surgical equipment, or safe is like more like safe surgical teams. Ensure that all the staff, all the staff involved in the surgical procedures are full equipment with the necessary for the surgery, and this implies that the equipment condition before the procedure begins. So, with this, next slide, please. So, with this objective, what is the WHO pretend to create? Is the safe? The answer is the surgical safety checklist. This checklist was developed to help surgical teams to reduce patient harm. It was developed following three fundamental principles. The first one is simplicity. The checklist, it was designed to be easy to use and easy to understand. A soft list of standards could improve patient safety. More complexity makes implementation and acceptance more difficult. Therefore, priority was given to creating a tool that was direct, accessible, and more comfortable. The second principle, it was the measurability. It is crucial that the effects of the checklist can be measured and evaluated. This implies that meaningful metrics must be established that allow health professionals to assess the impact of the list on reducing surgical errors and complications. And the last one is a wide or scope of application. This means that broad application. The checklist was conceived to be useful in a great variety of settings, from resource-rich hospitals to those with limited resource. This means that although contents may vary, surgical safe issues are common and can be addressed with solutions that are effective in any settings. So, the WHO surgical safety list is basically a tool designed to improve the patient safety during surgical procedures. This is the checklist. The objectives of the creation of this checklist was minimize errors, improve communication within the surgical team, and standardize procedures. Basically, the checklist structure is divided into three phases, each corresponding to a specific moment in the normal flow of the surgical procedure. The first one is sign in. So in the sign in, we got the confirmation of the patient identity, surgical site, and what is the procedure that is going to be performed in the patient. Also, we got the review of risk of blood loss, breathing difficulties, and allergies, which is important for the anesthesia in the procedure. And we got the verification for that the review of the anesthesia machine and medication. In the second part, we got the time off. That is before surgical incision. We got here the final review of critical information by the entire team and the confirmation that all the team members are ready to proceed. And the last part is called the sign out. we got in the sign out, there is the part that confirms that all the instruments and sponge or MDs have been counted, and we got the verification that all surgical specimens have been identified and labeled correctly. And finally, we got the review of the postoperative care plans. So finally, what is the we got to talk about what is the benefits of this checklist. First one, we got the first one is the reduced complications. Studies have shown that the implementation of this type of checklist can reduce the complication rates and mortality in surgery. Second one, we got the increased patient safety by following a standardized protocol. The overall safety of the patient during the surgical procedure is improved. And finally, the facilitation of safety culture. Because this checklist promotes a culture of safety in the operating room where all the team members feel responsible for their patient. So basically, that's it. For the conclusion, we got the WHO surgical safety is a critical tool to improving surgical safety for the patients. Thank you.
Thank you. Bye.
Listo. Ahora tiene que parar la grabación.
Voy. Detener a alguien. Yo lo edito.